Well, let's talk about vaccine misinformation. Our next guest is here to clear up some confusion. Devin Grayson is an assistant professor at the University of British Columbia and a health information scientist who studies why many people don't trust vaccines. Devin, great to have you on the show.
Great to be here, Molly.
Devin, I have to start with a viewer question. We were asking people about vaccines online. This is Nick from North York, asked us on Instagram, why are vaccines that have been around for decades suddenly being questioned? What does your research tell you?
This is a great question. We have, had a long period of trust in vaccinations such that we have not seen a lot of diseases such as measles around. And we've sort of become a little complacent. We forget how bad those diseases can be. So we sometimes overweigh the very rare and small risks of vaccination and compared with the more serious and more common risks of the actual disease because we don't see the disease very much anymore.
In today's day and age, though, we're seeing it on social media, right? That anti-vaccine narrative. What are the red flags that you were watching out for?
Well, hallmarks of sort of anti-vaccination content that is likely untrue tend to be things like very exaggerated claims that there's a big secret or a big conspiracy that somebody doesn't want you to know. Also, when these claims are coupled with someone trying to suggest or sell an alternative treatment or something to detox from vaccines. You don't need to detox from vaccines. They're very safe and effective on their own.
So people should be watching for those very carefully.
Yes.
Devin, I feel like COVID made this entire conversation even more challenging. Where or did the public health messaging go wrong in our communication about vaccines and what they actually do?
It's such a great question. And COVID was a very new thing for us. It was really the first time we've tried to get everybody, even healthy working age adults, vaccinated against something new. So that was a really new thing for us. Usually we're vaccinating children or vaccinating seniors or other sort of specific groups that are at risk. So vaccinating everyone was really new. And it overall went quite well because a lot of people got vaccinated. Most people got vaccinated in Canada, and it's completely changed the way we think about COVID as a disease and how we experience COVID as a disease now. And so things went relatively well. However, a lot of people had to make decisions that they hadn't thought about before or hadn't been faced with before. And coupling that with some of the political things that were going on at the same time and people's feelings about maybe requirements, different types of vaccine mandates, or other public health requirements that were happening at the same time, if people had negative feelings about those, sometimes that could affect the way they're feeling about the actual vaccines themselves.
Well, we just heard from a doctor here in Toronto that was telling us that vaccination rates for measles are falling. That's, some of that because of how people felt about the pandemic. So do we have to change the way we communicate going forward?
I think we can do a better job of communicating with communities that are not receiving enough vaccination to achieve levels of community immunity to protect people in the community who can't be vaccinated, babies or people who are immunocompromised, for example. So certainly some things we know we can do a better job of is partnering with community leaders, listening to community leaders on a regular basis to understand the values and needs of their community, and building strong relationships so that when there is an urgent message, we can get it out and the community leaders will help us share those messages from public health to the population.
And so a lot of that communication has to come from trusted people that are not necessarily in the medical field, but that it translates through to trusted people that are already there doing life with people every day.
For many Canadians, trusted people do include their regular medical providers, whether that's a family physician or a nurse or, a midwife, a naturopath in some cases. However, not for everybody. For some people, there aren't trusted healthcare providers. And for some people, the government public health officers also aren't trusted. So they're going to look to other community leaders, whether that's faith leaders or cultural community leaders or other local leaders. So those folks also really need to be engaged in public health efforts.
We all play a part, Devin, that is for sure. Thank you so much for your valuable insight.